Good morning, Ms. Diaz.
Good morning, Commissioners, everyone. My name is Yoli Diaz. My comments pertain to the February 3rd work session of the Healthcare Assistance Program. Please consider removing barriers to access needed health care that have existed since year 2009-2010 as presented in the work session. And consider social determinants of health. First and foremost, please consider that you're talking about people's lives, their life and safety. Limiting healthcare harms the indigent the absolute most. Now, I'm going to go into different items, but I may not finish as I normally don't here. So I do want to say that payer of the last resort is a huge, absolutely huge barrier. So I will leave it for last and get as far as I can. So regarding a medical director, you should consider that your contracted primary care provider should be providing referrals for the next level of care, the care that they are not able to provide, which is specialty care. Therefore, you should consider helping them ensure a diagnosis is in reach by paying for diagnostics for the residents in HCAP, since HCAP pays the primary care providers. Makes sense, doesn't it? What you need is a list of illnesses, which you should consider contacting the state's medical division or healthcare authority or UNM Health to acquire a list. Please don't create another barrier for cancer patients. A cancer diagnosis can definitely lead to premature death. Regarding the very poor scenario of a 53-year-old with $2,000 monthly income, is Doña Ana County hiring the indigent? Is Doña Ana County hiring the indigent? Since Doña Ana County is using the Affordable Care Act's employer shared responsibility affordability rules. Under the Affordable Care Act, applicable large employers must offer full-time health coverage that meets the law's, quote, affordability standards. This pertains to large employers, generally 50 or more. In 2026, the rate is 9.96. The scenario was a very poor example because highly likely this resident would have had a $0 monthly premium under the marketplace. Commissioners, please consider fair, equitable scenarios that also consider all indigency statutes. Consider income guidelines pertaining to accessing Medicaid and the marketplace, which some, if not most of these residents are not eligible for, but can be compared to. Thank you.
Thank you, Ms. Diaz.